In March 2020, the COVID-19 pandemic hit the United States. At the time, hospitals were largely unprepared and acquiring personal protective equipment, PPE, was difficult. Many organizations rapidly adapted to contribute and aid the process by creating their own PPE.
PPE, right from the beginning, we knew was going to be a logistical nightmare. We saw that there'd be a national demand, and we knew there'd be significant lags. That's where we had such a great relationship with RB Medical. They were right there as a partner, and they were very generous. They were donating a great deal of materials. Candidly, I was one of the people who was one of the delivery people, picking materials up, dropping it off at our emergency operations center, making sure that our first responders had the materials that they needed to do their jobs.
As the president of RB Medical Supply, we have always done strategic supply chain sourcing. So when the pandemic started here in Ohio, a lot of our healthcare customers started reaching out to us asking, could we get these hard to find PPE items? We could source them. They asked us, can you start distributing them for us, which we did. And then shortly thereafter, we started manufacturing products here in Mentor, Ohio in July of 2020.
Months after the outbreak, shortages of PPE are no longer the problem. The next obstacle for ending the COVID-19 pandemic is effective vaccine distribution and documentation.
As we're looking at the COVID-19 vaccine, you're looking at herd immunity, right? And how do you get there? You get there through vaccinating a number of people at one time. That's going to be a very heavy workload on a lot of our local health departments because the process right now is for the health department to manually put in each patient's data. And quality management systems teach us that 20% of anything humans do is going to be wrong. So there's going to be a large amount of human clerical errors in that manual data entry process. That's going to be a big challenge for those groups.
We are very used to running routine immunization clinics, but for something like this on this large county-wide, statewide, nationwide scale, we knew that we would need to look at doing things a little bit differently. So how we could scale our vaccination response while still making sure that we're doing it in a safe way and capturing all the needed data were top of mind for us. Using an electronic health record that's not really built for that was really not feasible. So we are now using ArmorVax for all of our data collection and inputting.
My grandfather was a Marine in World War II, and his role was to supply ammunition and supplies to his troops in Iwo Jima and Guadalcanal on the Pacific Front. And I believe it's our role and our company's role to supply solutions like manufactured product made in the U.S. and software that can help people get vaccinated as quickly as possible in an efficient manner using ArmorVax.
RB Medical Supply is a medical supply company that makes and distributes personal protective equipment. At the forefront of the COVID-19 pandemic, when supplies of PPE were limited, RB Medical donated hundreds of thousands of masks to first responders and frontline workers.
RB Medical Supply was able to respond so quickly to the need of PPE during the pandemic because we've done strategic supply chain sourcing for the last 5 years. We knew where the product was coming from. In this case, it was China. We negotiated strategic contracts with manufacturers and distributors to start acquiring that product. And in April, we chartered an Antonov 124, which is the world's second largest aircraft. So it was our company's history to be able to find things that are difficult for others to source, but it's also been in our DNA to do continuous process improvement. And that allowed us to quickly start manufacturing N95s and surgical masks in July of 2020.
I've seen RB Medical Supply grow really from infancy. So I started right when the medical supply company was created. We were able to bring in PPE. When it became prohibitive, we started manufacturing our own. And that's helped us grow in a huge way. We've created jobs in a time of economic downturn. We started with about maybe 10 people. We're now up to over 80 people employed over 2 sites. So it's been great since we started manufacturing. We've perfected that, and now we're working on ArmorVax development and really bringing that to a nationwide audience.
RB Medical Supply is continually at the forefront of the pandemic. Recently, they developed ArmorVax, a healthcare application designed to facilitate and expedite the vaccination process. The mobile app helps users locate the most convenient vaccination provider, schedule an appointment, and effectively record vaccination data.
For us, ArmorVax has been an invaluable resource. It has really allowed us to not only increase the number of appointments that we are seeing, but then to also keep us from having to do that manual data entry on the back end. From the consumer end, we've heard a lot of positive feedback about the ease of scheduling and them having that 24/7 availability to be able to make their own appointment and to decide where and when they can go and be vaccinated.
We have a lot to be proud of here at Army Medical Supply. We've done a lot of great things for our own community and then communities across the country. Over the summer, when there was unrest in Minneapolis, we donated 70,000 pieces of PPE to the local emergency services organizations. We've donated over 400,000 masks to the Ohio Department of Elections to make sure that election workers have the masks they need to work safely. It's a company that has listened, that has been flexible, and that has been agile to really address all the concerns throughout this pandemic, and that's what I'm most proud of.
To learn more, contact us today.